The Gut Microbiome Health Program is about optimising health for people with symptoms, reducing risk of future symptoms, and also for people that want to optimise their health now when they're doing all of their other checks around colonoscopy or their PSA or their other cancer screens. It's really built for all of our patients, anyone with a gut microbiome. Microba does a superb job in making what is historically a complex topic really digestible. So the microbiome is an important pillar of gut health. Gut health is about balance in our digestive tract. We have about 30 trillion human cells in our body, and we have about 39 trillion microbes. About 99% of our genes within our body are actually microbial genes rather than our own genes. And there's not a gastroenterologist in the world that wouldn't believe that the microbiome is fundamental to human health. So for people that are committed to getting better or to preventing future disease, I think speaking to your general practitioner is a really valuable thing to get you some more information on whether this is right for you. And I think then there's a real opportunity for you to discover more about yourself, to help understand how you can optimise your diet and hopefully prevent future disease.
So if you sign up for the Gut Microbiome Health Bundle, you start by completing a detailed health assessment. We also get an idea of your current dietary intake and complete a food diary. We then send you the microba test to do your own microbiome test in the comfort of your room when it suits you and send it back. In addition to sending this, you get the Power of Plants handout to get started on your gut health journey. So even whilst you're waiting for your test results, there's some things that you can be doing to get going. Once we have your test back, you have an individualised consult with an expert dietitian in gut microbiome health. The dietitian will take you through your report. They will give you personalised recommendations on what you should be eating. They may make some supplement recommendations, as well as developing 10 personalised recipes for you to help improve your gut microbiome. You then also have access to a bulk billed gastroenterology review if your microbiome indicates that that might be required. Follow-up from there can be organised as clinically indicated. So no microbiome is the same, so we only provide recommendations that you need. So you don't have to avoid things if your microbiome isn't saying you need to. So it is really individualised.
So we only use tests that use metagenomics because we don't want to just test a small suite of microbes and be like, are they there or are they not? We want to get a sense of the entire community of the microbes. Metagenomics also gives us the capacity of the microbiome to produce certain compounds. So I always say, if you're going to give the microbiome one job, it's to take the fibre from your food and produce butyrate. Butyrate is a very important short-chain fatty acid. It is the primary fuel source for the cells that line your colon. So if you're not making butyrate, they're starving. We know of some really famous butyrate producers. It is possible that we would measure those and they'd be low and we'd be like, here's a problem. But in fact, there's many others that are only captured by metagenomics. So by metagenomics, we can say, look, you don't have any of the famous ones, but you still do have plenty. It's not a problem. Conversely, sometimes we see the difference. They have the few famous ones, but overall, they actually don't have enough capacity. So that's why tests that only look at a small portion can really mislead how you treat things. As I always say to patients, we've only started testing the microbiome recently, but it's always been there. So it's always been something that we're considering in how we give your advice, making sure you're having the right fibres and so forth. But by actually knowing what's going on in your microbiome, it takes some of the guesswork out. So it means we'll get to solutions quicker.
A lot of our patients have been back and forth between clinicians with no answers and do get quite lost in the healthcare system. And so that's why we developed this program that has the patient in mind, and why my role as concierge is to hold their hand throughout this, from sign up to kit delivery to the dietitian appointment to getting your results. And you are not alone in this journey. When you sign up to the program, you're not just getting a test, you're getting a dedicated team behind you the whole way.